Today, let's talk about something common, something important but yet ignored. Vaginal laxity. Hello, I'm Dr. Smriti Nathani, a plastic and cosmetic surgeon, consultant at Tamira Plastic Surgery, Chennai. Today we will talk about, as I said, a very important topic, that is vaginal laxity, vaginal looseness. Who gets vaginal laxity? Almost every woman in their postpartum and perimenopausal state will get vaginal laxity. So it happens due to childbirth, hormonal changes, and around the menopause when the pelvic floor and the vaginal muscles starts getting loose. Now, why are we talking about it? How does it affect a common woman? And should women consider about getting treatment for vaginal laxity? Now, it is something which we have to understand that it is something very much related to the intimate health of the women, and then indirectly related to the intimate health of the partner as well. Secondly, it can immensely affect a woman's confidence because, as we know, when the intimate health, when the intimate relationship is not good, it can very positively affect a woman's mind and even the confidence. Now comes our questions. We have vaginal laxity and we understand it, but then what to do about it? There is only one treatment, that is surgery, which is known to many people till now, that vaginal laxity can only be treated by surgery, where the vaginal tube, which becomes broad or which becomes loose due to the child passes during the childbirth and due to the hormonal changes, needs to be tightened and squeezed by surgical means so that it becomes again like a tight vagina, which was the pre-pregnancy status. But this is not it. There are even non-surgical, there are so many advances that has happened now in today's world that even non-surgical treatments are available which can very effectively treat your problem. Now, what are these non-surgical treatments and why are they sought out? So many women are sorting out for these non-surgical treatments. The reason being, first, many people don't want to go for surgery for these concerns. They don't want a hospital downtime. Second thing is, many women, they even don't want their relatives to know that they have undergone a surgery for that, because we accept it or not, it is still a kind of a hush-hush situation, or maybe a little sentimental taboo for women to come out and accept that they have undergone a procedure for this, even though they want it a lot. Now, when we do a non-surgical treatment, is it effective? Will it give as much effect as the surgical treatment does, or it is just mean of getting a treatment done for the sake of it? No. So I am here to tell you that how and what are the non-surgical treatments which are very, very effective in treating the vaginal looseness or vaginal laxity. Radio frequency microneedling and electrical muscle stimulation, that is called as EMS, are the new devices, rather new for India, not for outside the world, and many people, many women are benefiting by it. What is done in this procedure? I will tell you today that this is the procedure. Obviously, the surgery is a one-time procedure, but the non-surgical procedures take multiple sessions, because remember, we are trying to treat your problem without any cuts, without downtime, but yet giving you effective results. I will try to explain you with an example. When you go for face laxity, when you have facial loosening and you want the tightening of the face. So one is obviously the facelift, which is surgical, but not many people go for it. Nowadays, we are well aware how many procedures are there for tightening the face which are non-surgical. Obviously, they take 2 or 3 sessions, but they give as good as effect for the people who don't want to go for surgery. Similarly, in the vagina, the non-surgical radio frequency, microneedling RF and electrical muscle stimulation give you exactly the same effect. I would tell you today that it is even better than getting a surgical rejuvenation or surgical tightening, because the other reasons, other problems which are treatable by non-surgical methods. Like we have a platform like Empower RF, which has microneedling RF, radio frequency and EMS. Along with just tightening your vaginal tube, there are many concerns which women undergo in day-to-day life, like dryness of the vagina, like having constant and recurrent vaginal itching, painful intercourse, and as a result of that, there are many women who suffer from the dribbling of urine in some point in their life, that is after 2 or 3 childbirths or when they are nearing the menopause. Why does this happen? Because as every part of our body becoming lax and sagging, so is our pelvic floor muscles. So the pelvic floor muscles which were tight, because of all these changes, they start becoming lax, and that is why the vesico-urethral reflex, the urethra part, all these becomes lax, and that is where this comes into play. Non-surgical devices are very effective in tightening your pelvic floor, restoring the balance of the anatomical balance which was there before, treating the mucosa, improving the mucosal health, so that the problem of dryness of the vagina, itching of the vagina, painful intercourse, all can be treated by proper combination of these procedures which are available to us in today's world. Now, who will be benefited from it? As I told you, the women who are after 2 or 3 childbirth, they have vaginal delivery, heavy baby, long duration of delivery, and during the menopause, they all are affected in spite of they are leading a healthy life, a fit life, or whatever. The people who are fit, who are doing exercises, who are taking care of their pelvic health, do have these problems encountering later in the life, like I said, menopause. But most of the women, if you have a mother, you have a grandmother, you have a sister, or even you, ask them, everybody is suffering with this problem. They may not be open about it. Reasons, as I said, they are ashamed about it. Second thing, they don't know if there is something which can treat their problem without surgery. So yes, I am here to tell you today that yes, these problems are treatable, and not only treatable, very effectively treatable. Third is the confidence. Confidence matters, and it matters a lot. I have seen in my patients how treating their stress urinary incontinence, their vaginal laxity, their dryness of vagina has improved the confidence in them, and the smile changes. And my patients come to me and tell me that, doctor, thank you because you have helped me so much. The procedure was painless. It was a lunchtime procedure, took only 2 hours, and I could walk home normally as I walked in the clinic. So these are the benefits of these procedures. If you have any other concerns or comments, queries which you would like to know, please DM, and I would like to answer all your queries. Thank you so much.